From real estate to real life and everything in between. The Brad Weisman Show. And now, your host, Brad Weisman.
All right, here we are back in the studio again. Oh, this is going to be a really cool show. This is going to be different than any show we have ever done before. In fact, you probably will realize that because look what I have in my hands here. I have something, well, they're teeth. They're not mine. They're actually Hugo's teeth.
That's right.
Hugo, these are your teeth, right?
That's right.
Yeah,
that's
I'm sorry,
right.
Hugo, but
I
I had to use something as a sample. But no, we have Tammy Balagtek here, Dr. Balagtek. She's here right now to talk about, it's the Center for TMJ and Sleep Disorders. You actually, well, I've known you for a long time, yes, but you actually helped out my wife at one point. She had TMJ. And we came to you, or she came to you, and you made it all better. So it just has made me interested in this from that point on. So how you doing?
Awesome.
You awesome?
Yes.
You doing well?
Thank you for having me.
And she brought toys.
That's right. That's
This
right.
is the first guest that could have brought toys. So what am I looking at here?
You are looking at a plastic model of teeth.
Okay.
And there is a clear aligner on top of that.
That's the like an Invisalign, like
right,
that.
to
So this is
straighten
what we have here. We have this thing here, and what we're looking at is a set of teeth with the Invisalign on there. And this is something they're using now to straighten teeth, right?
Correct.
Yeah.
Yep. You wear a series of aligners and it'll straighten the teeth.
Amazing, amazing. Well, let's go back to TMJ because that's the one that seriously blew my mind because of the amount of, well, how many people have it? There's a lot of people that have it, right?
Yes. The studies say maybe 1 in 4 people have a TMJ problem.
How many so that's 1 in 4. How many that don't know they have this? Because
A lot of them.
when I was looking at the what you could suffer from with the TMJ, it is incredible. I mean, some of the stuff that stuck out to me, neck and throat pain, I get that. Tired, tight jaws, pain behind the eyes.
Yes.
I mean, that blew my mind.
Yes.
What is TMJ?
She'll tell you.
All right.
Good question.
Good question.
TMJ is the name of the jaw joint. So I'm going to hold this skull up here.
Okay.
And from the side view, this hole would be our ear canal.
Right.
And then right in front of our ear is our jaw joint. And that's the joint that connects the lower jaw to the
Kind of like a
head.
hip joint almost, right?
Just like a hip or a
Okay.
knee. It's a ball and a socket joint. So
Okay.
you have the ball part on the
Yep.
lower jaw. And then the socket is the ear bone. So in your list of symptoms, that's where patients can have ear pain
Yeah.
or clogged ear feeling. And then there's a piece of cartilage in between. So there's supposed to be like a disc or a meniscus in there.
Yeah.
And that's a protective mechanism.
Now, what do you find is the norm? Is it that the cartilage isn't there? Is it that it's just misaligned from birth? Is it like, what are the causes of this?
It can be any stages in between. So
Okay.
the cartilage could be in place and someone could be clenching really hard and
Okay.
get muscle inflammation leading to headaches. It could be the cartilage is slipping out of place and that causes popping and clicking sounds in the jaw and then it gets inflamed, so it hurts.
Right.
Or the cartilage can get all the way out of place and then you get bone rubbing on bone and that's arthritis.
That's not good. That's arthritis, and that's bad.
That's
like a bad hip or a bad knee or whatever,
Exactly.
because there's nothing there to protect the bone on bone. Now, is there surgery that they do for these things too?
There is surgery, but it's not typically recommended.
Right.
And that's because the jaw joint's unique because we have the teeth and the mouth as the end point. So if you did surgery but didn't correct the bite or how the teeth fit together,
Gotcha.
it may not help the alignment of the jaw.
Amazing.
But something interesting about the jaw that the hips and knees can't do is it can generate new tissue. So there's a different type of cartilage that covers the jaw joint.
Yeah.
And it can actually make new bone and a disc in there with proper positioning.
Really?
So yes, really, our knees can't do that.
No.
Our hips can't do that.
Interesting. See, look at that, Hugo. You didn't know that.
No, I didn't know that.
That is pretty interesting. So
Yeah.
it can actually regrow.
It can.
That's amazing. So, okay, so what do you find people are coming into you with? Like, what is the main symptom people come in and go, this is just driving me nuts, or I can't handle this? Or what is it, headaches? What is it?
It's usually the point where their jaw gets locked and they can't open and
It
chew
actually gets
functionally.
locked?
So, yes, locked meaning they can't open it normally. So they have to limit how they eat their food. It's very painful because it's stuck and
Yeah.
they can't chew right. So that's usually the point where patients come in.
Can you unstick that when they come in?
We can, yes.
They punch him in the jaw is what they do, Hugo. She just hauls off and nails him right in the jaw.
Not like popping his shoulder.
Not like popping his shoulder? No, it's not. Okay, you don't
no.
just give him chewing gum or something? No? Oh, man.
We use a cold laser or an ultrasound on the joint to relax everything.
Okay.
And then we show them an exercise to do.
Wow.
And then if that doesn't work, we prescribe appliances.
Right.
So the appliances, just showing on the skull here, can move the mouth open a little bit, which then moves the jaw to give room for that cartilage.
Unbelievable. Yeah, and I think that's what Jess had, if I'm not mistaken. I know she had a lot of headaches, a lot of pain, like severe pain in the jaw. And I just remember that, and I have to say, I'll be honest, but at first I was not a believer. I was like, you're telling me that this thing that you're putting in your jaw at nighttime or in your teeth at nighttime, is that it right
This
there?
piece of plastic.
That's it. That
It's a
piece of
sample
plastic
one.
is what's going to make you get rid of these bad headaches and the pain in your jaw. And there was a lot of things going on there. In her ears, she had pain in her ears. And it was amazing. And the only reason I trusted is because I knew Tammy for years. I sold her house actually years ago.
Yeah.
So I was like, okay, I trust her. She knows what she's doing. And it worked.
Yes,
It really worked.
yes.
It relieved her pain and discomfort and grinding and all that stuff. And to this day, what's amazing is she's now doesn't have to wear the appliance, and it's still great. Yeah.
Yeah.
So that's the appliance right there.
This is a sample appliance.
Okay.
Yes. This is an upper and a lower that connect to the teeth.
Yep.
And then it keeps the lower jaw in place. So
Gotcha.
it prevents it from falling out of position at night.
I'd like to thank our sponsor, Brandon Moyer of Made to Be Clean Cleaning Services. They use low-toxic cleaning solutions to make your home or office clean and healthy. Made to Be Clean, your hive, our purpose. 484-509-7197. Amazing.
There's other appliances. There's single arch ones, which just go on the top teeth.
Okay.
And these are commonly used for grinding at night.
A lot of people grind, don't they?
And then they do.
Why do we
Yeah.
grind?
Well, that's a great introduction to sleep disorders.
Yeah.
So
Okay.
at night when we fall asleep, if the lower jaw and the tongue drop out of position, and I'm just going to hold up this view here.
Oh, there's a
so
nice
you can
view.
see the airway is getting closed off.
So you're
by
showing,
the
is
tongue
that
and
the back
jaw
of the
dropping
tongue?
up. That's
So
the
what
base of
she's
the
showing
tongue.
on here is the back of the tongue or the back, it's cutting off the airway.
Right. So the only body part that can move to fix that or give us more airway is this lower jaw,
Yeah.
which connects at the jaw joint.
Why does it look like that
So-
guy has a really fat tongue? Is that the way our tongues look when we're sleeping?
Our
Because it goes
tongue
back
is
in
a
there?
large muscle and it fills the entire mouth. So then when we relax, it loses its
Yeah.
tone
It looks
and
like he has
drops in.
like something in his mouth. It's crazy. Okay. Got it.
So clenching and grinding could be a response to
that.
the airway closing. And then patients are basically doing CPR on themselves all night by
Oh,
moving
geez.
the tongue and jaw forward for more breathing.
And that's not good.
That's not good.
Yeah, because that's where you can really run into some problems, right?
Right, right. That can cause heart issues.
Yep.
It can cause stroke. There's a lot of
Let's go back to the TMJ, and then we're going to go back into the sleep apnea because there's some stuff about the sleep apnea and snoring thing which I never knew. What happens if you leave these things untreated, like the TMJ? What does it get to a point? Like, do you see people coming in that are really severe?
We do. The main thing that drives patients to us is the pain.
The pain.
So you can have an arthritic jaw that doesn't have a cartilage, but if it's not inflamed, it may
okay.
not
Yeah.
hurt.
Right,
so, so the breakdown is that once the cartilage is out of place, then the bones can rub on the bone and cause the arthritis.
Gotcha.
But it's the inflammation in there that drives
really-
patients to come in. So we see 12-year-olds with arthritis. We
Really?
see 80-year-olds with arthritis. And
Interesting.
It's all based on how much inflammation they have.
Amazing. Now, what about chewing gum? Because I chew gum a lot. Did you see that face she made? She made a face that was like,
We actually recommend if you can chew gum and you can use your jaw, go for it.
Oh,
Because
really?
Patients who have arthritis and they don't use their jaw, it forms scar tissue and adhesions in there, and then it gets worse.
I
So
love chewing
the
gum. Thank
more
God she didn't diss the gum chewing.
Yeah, go for it.
Yeah, and it's sugar-free because you were a dentist. You are a dentist also, right?
yeah,
So it doesn't hurt anything. Okay,
It's
good.
fine.
Phew. I was worried about asking that question because I like to chew a lot of gum, and I was like, oh man, if she tells me that's going to hurt my jaw, it's going to really be bad.
Nope, you're good to go.
Good.
Yeah.
Now, what about chewing on things that are really hard? Is there anything that we shouldn't be chewing on to stay away from this kind of stuff, or that can make our situation worse?
Well, from a dental standpoint, chewing on ice is not a good thing because ice will cause the teeth to get so cold. And then if there's any like fracture lines or graze lines, they could break. So ice is not good in general.
Okay.
Any habits that move the jaw, like a pencil or even fingernail biting, you're moving the jaw position. So then that can cause the cartilage to move around. So from that standpoint, it's more about the structural way that your jaw moves of what you're chewing on.
Now, when you wear those, is there a point where, like I've heard of people saying they have like an underbite or an over, is there a way they can fix those things too, obviously?
Sure, you can have orthodontics.
Yeah. Now, do you do that?
Mm-hmm. We do.
That's what I thought.
We
okay.
do. Yeah. Because a lot of patients who go through the TMJ treatment, they have crooked teeth to begin with, and their jaws are out of alignment. And then when the jaw's in alignment, they want better chewing function. So then they get their teeth fixed through orthodontics.
Wow, amazing. All right. So let's jump back into the snoring and sleep apnea, because this was interesting for me. I read it on your website that I always thought that basically snoring and sleep apnea were the same thing. And it's not
They're
exactly
not
the same thing.
Correct.
It's actually different. So you could actually be a snorer without stopping breathing many times in an hour.
True.
Right?
And you could have sleep apnea and not snore. You could be a silent
that
apnea.
really blows my mind even more. You can be a silent sleep apnea?
Yeah. Mm-hmm.
See, I always thought I was the person that was like really going at it, that was the person that was like having a hard time. That's amazing.
Well, that's the stereotype. And that's why women are often underdiagnosed, because they're not loud snorers.
Yeah.
And they might clench or grind their teeth to clear their airway, but they might actually have sleep apnea.
Yeah. So going back to sleep apnea, how bad it can be, you can die from it.
You can die from it, yes. If you stop breathing long enough and it shuts down the systems in your body, you can die from it.
It's amazing. And also high blood pressure, right?
High blood pressure, stroke, memory loss, feeling like you're in a fog, moodiness, anxiety.
Crazy.
All those things are symptoms.
Yeah, it's amazing. So now go back to, what you do for sleep apnea is you're using an appliance, like you had said, to pull the jaw forward, or to pull the tongue up and jaw forward, instead of other things like the CPAP machine, which looks like you're Darth Vader, basically. Right. Or now it looks like you're a fighter pilot. Did you see, like, in Top Gun, they wear those things that they breathe through? That's what the sleep apnea things look like, the CPAP. Oh, you have a CPAP.
Exactly. Well, I have a picture of one. So this is the CPAP mask, and it attaches to the nose or the nose and mouth.
Yep.
And then there's a bedside unit that makes air pressure.
Right.
So because the airway is collapsing and the tongue's closing off the airway, this air pressure is blown through the throat, and it keeps some pressure there, like blowing up a balloon. And then that keeps the airway open.
It's amazing. It has to be a little uncomfortable, I would think, or something. I don't know.
A lot of patients don't tolerate them well.
Yeah,
and you must tend to lay on your back, because if you turn on the side, the seal will break, and then it doesn't work. Ineffective.
Yeah. Are your kitchen and bathroom remodels a little overdue? Well, now's your chance to call First Response Contracting. John Sellers will take care of you. 484-256-7136. They do residential and commercial, and they're licensed and insured. Give them a call at 484-256-7136. So then what's the other thing you got here?
Well, this is showing how the oral appliance works. So the oral appliance is a mechanical way to open the airway. So it hooks onto the teeth, and then it pulls the tongue and jaw forward and opens up the airway.
Now, is that uncomfortable? How does that feel inside your mouth? Does it feel like you're choking it on? No, just pulls the tongue.
It opens. You don't even feel it on the tongue. It's just the action of the jaw and tongue moving forward that it creates more space in there.
Wow. Have you ever used one?
And I do. I wear one of these. I have mild sleep apnea.
Okay.
I had some teeth pulled when I had my braces, which made my mouth smaller, so my tongue doesn't have enough room in there.
Oh my gosh,
so at
that's
night, it falls back. So I actually wear one of these appliances every night. and it keeps my airway open,
And you feel it.
I
You
don't
feel
get
the difference.
headaches anymore.
Yeah.
Oh yeah, I can't sleep without it.
Yeah. And how much easier, like what you can't see, like if you're listening to this, the sleep apnea machine is not something you're traveling with very easily.
Right.
Okay. Whereas what you're showing me here is basically just like wearing Invisalign on the top and bottom, basically.
Yeah,
That's what it
you
looks
just
like.
put it in your carry-on bag and in a case, and
Yeah.
yeah.
Yeah, it's crazy. That's amazing. So what else? Let's go back to snoring. Does that appliance help with snoring then too?
Yes, this appliance works with snoring. So snoring is the first stage of an airway issue. And it's because there's a narrowing of the airway. So it could be in the nose if there's a deviated septum.
I have one of those.
It could be the back of the throat, so the uvula piece that hangs down can get inflamed, and it could be the tongue. So when the airways narrow, the air has to go faster, and it rushes and it vibrates and causes the snoring sound. Well, as the tissues get more relaxed or the airways more compromised, then it leads into sleep apnea because the body's not responding to open it up anymore. So the patient might just stay asleep and then they're stop breathing for 10 seconds, could be 20 seconds. It's a long time that we stop breathing. And then the brain has to send out adrenaline, which says red alert and wakes us up.
Oh, wow.
And then we
Interesting.
either toss and turn or clench or grind or kick our jerk our legs.
So that's why we do that, is because your body sent out the sign of, hey, you're not breathing, you idiot. You better wake up.
Exactly.
And so it's the fight or flight thing. It's you got to do something.
Exactly. And that's why patients are so exhausted the next day, because their body's been running this race all night.
And then, okay, so alcohol. Not saying that I drink any. I'm just saying that sometimes I do. But it does make your snoring worse.
It does. It relaxes the tissues, so it makes it worse.
Gotcha. I thought so.
Alcohol, smoking.
Any of that stuff.
Some of
All the bad stuff.
Medications, sure. Yep.
All the bad stuff. Amazing. All right, so the other thing I saw in here that it said on your website, physical medicine, how do you say this word?
Modalities.
Modalities is what I was going to say. What is that?
That's just a fancy word for like the cold laser or an ultrasound.
And what do we use that for?
So for patients who have jaw pain and inflammation,
you do it here?
we do treatments. So just like if you had a bad knee or a bad neck and you went to a chiropractor or someone and they did some therapy on it. It's the same thing for the jaw.
Amazing. And then you do orthodontics. And what's the craniofacial pain? Is that just basically all the pain that you get from?
Yep, that's just the name for pain around the face that's associated with the jaw.
What's the best thing to take if you're having that kind of pain before you get the appliance and just to have it bearable?
Yeah, usually just try an anti-inflammatory.
Yeah, like an Advil or something like that. Okay.
Right. Tylenol doesn't do much because it's just for pain relief.
Yep.
And then just trying even like an over-the-counter mouth guard sometimes can be enough to break the cycle.
Yeah.
But the ones that we make are all custom made.
Absolutely. So what do we do if we have this issue? What do we do? Or we feel like we're doing something. Can we come into you and you can kind of do a check on everything to see what's going on?
Sure. Yeah. Our first appointment is a comprehensive exam. So I'll spend a good amount of time examining the patient, looking at their bite, their muscles, how wide they can open. Yeah. And then we give ideas right there on a treatment plan. And we even have temporary devices that a lot of patients leave with that day.
That's cool.
We can do a laser treatment or other things. We can get their jaw unlocked at that appointment. So we have a lot of time to try and work with them that day.
Yeah. And then what happens then? Then they say, okay, I need something for this. Then you do like a mold of their teeth.
Yeah, so we are all digital now. We do not do impressions anymore. I don't know if you've ever had a goopy impression.
Yeah, they're horrible.
They're horrible, right?
Yeah, they're horrible. No goopy impressions anymore?
Now we use camera pictures. So it's called a scanner, and it just goes along and scans the teeth into 3D, and then we 3D print the models. So this is an example of a 3D printed mold.
So that's somebody's teeth?
Yep, that's somebody's teeth. That was
Hugo
printed instead of made.
Ooh, they need some things done here. I don't know. We won't say whose teeth they are.
A little crowding there.
In the front, very crowded. I mean, I'm not a dentist, but I've noticed that. Yeah. Interesting. Yeah. So you make that there. How does this camera get in your mouth? Or is it on the outside?
No, it's on the inside. It has a wand, and then you put it inside the cheek, and you just go along the side, and it takes hundreds of pictures and stitches them all together.
That's incredible. No more goopy.
Yeah.
No more goopy.
Yeah.
That is amazing. See, now that's amazing. Now, is there more technology coming out with this whole thing? I mean, you're kind of doing everything.
Well, 3D printing
Okay.
is the next. So a lot of these appliances can be made in a 3D printer, and then they fit. We don't have to make the mold then. We can just 3D print the appliance.
Right, because you don't need the mold at that point.
Right. Yeah.
Wow.
So that's new.
Wow.
And there are milled appliances, which is a different process where you take a chunk of plastic and then a computer cuts it out.
Amazing.
And they fit very nicely.
That's amazing. It's incredible where things have gone. Well, I got to tell you, I want to say thank you for coming out today.
Sure. Thank you for having
now,
me.
say again how we get in touch with you. What's the best way? Website? Is it phone number? Is there how do I get?
We do have a number 1-888-TMJ-SLEEP.
Okay,
That's easy to remember.
That's very easy to remember.
And then the website is tmjsleepcenter.com.
Yes. You guys do great work. I know it because my wife was in pain and she's no longer in pain, which is great.
Well,
so
thank you,
what a
Brad.
success story. It's awesome.
Yeah.
Thank you for coming out today and bringing all your fun toys.
It was fun. Thank you.
It's great. Thank you so much.
Awesome.
All right, there we have it. That was incredible. Center for TMJ and Sleep Disorders. It's Dr. Tammy Balagtek. She does an amazing job. She brought all kinds of things here. If you're having any kind of problems with your jaw or sleeping or snoring or whatever's going on, I would definitely look them up because they know what they're doing there. All right, that's about it. See us every Thursday at 7 p.m. Facebook, YouTube, Instagram, everywhere you want to find us. All right, bye.